Welcome to Fallopian Files, the visual podcast about all things woman for all womankind. I'm your host, Christian C. Thank you all for joining me today. I am really excited to discuss this topic, which affects many women out here today, and that is PCOS. I know many of you have heard of that or may even have had that diagnosis, but we're going to discuss PCOS today. So, what is PCOS? PCOS stands for polycystic ovarian syndrome. Polycystic, so multiple cysts. And when we talk about cysts, a cyst is a fluid filled sac. Okay, so that could be any type of fluid that you'll see. Some people have cysts. You've heard of cystic acne, is where you have a lot of fluid filled little pustules that show up in acne. So that is where that umbrella term of cyst comes from. But in PCOS, we are specifically talking about multiple cysts that are present in the ovaries, which can affect ovulation, it can affect your menstrual cycle, hormone levels, and definitely also can impact things such as insulin resistance and obesity, which all have a way of impacting the woman as a whole in terms of mental health, physical health, and then of course fertility. And you hear a lot about PCOS in women who are dealing with fertility issues because it is accounts for almost 50%, 50, almost 50% of the cause of infertility in many women. And it is also very prevalent where you can see roughly close to 20% of women in childbearing age have a diagnosis of PCOS. So it is very prevalent and has a large impact on fertility. And so I thought it definitely important for us to discuss it, just like we've discussed fibroids before. This is something that impacts many women and is not very clear. There's not a lot of discussion about it. You just hear, oh, you've got PCOS, let's try this and see if we can get pregnant. And or you're dealing with the signs and symptoms of it. But there's not much other discussion other than that's what you have. So I want to dive into this a little bit. Again, remember any information that is discussed on Fallopian Files is not a substitute for medical advice from your provider. Only you and your provider are going to be able to discuss your specific situation, knowing your health history, what diagnostic tools and tests have been used to help you develop your rapport with your doctor so that they can help you with a proper treatment plan. So please remember to take this information, verify it, fact check, do all that you need to do for yourself, and then be sure that you are taking this information to your provider to use for your health benefit. Okay, so let's get started talking about PCOS. So, PCOS, even though it is very prevalent, there is not much known yet in terms of what causes it and why it shows up in so many women. And I know that's very, very hard to believe, but unfortunately, there is still so much that we have yet to understand, so much that we need to understand and learn. There is still so much to learn about PCOS because we don't know the causes yet. And this just highlights how much research is still needed in issues pertaining to women. And it is important that we continue to advocate, fund research so that we can get some of these answers. But as we stand right now, unfortunately, there are no known causes for PCOS, but there are some risk factors that if you see it, you can definitely speak with your doctor about testing to find out if it is something that you are experiencing. Some of those risk factors include family history of PCOS. If you have a mother, sister, or even maternal aunts, cousins who have experienced PCOS or have received that diagnosis, that's something that you definitely want to bring to your provider. Also, if you have very irregular periods, where you're noticing that, you're either bleeding for long periods of time or you're going multiple months with no period and it's not due to a pregnancy or anything like that, that's something definitely to bring up to your provider as well as any instances of insulin resistance, like type 2 diabetes. That's something that is also a risk factor for developing PCOS. When you see your physician or your provider and you're talking about this, they may look at different things to help to diagnose you. So what they're going to look for, they're going to run some hormonal tests. They want to see not only where your estrogen and progesterone levels are, but they also want to see where your testosterone levels stand as well. Many people don't know that women also produce testosterone, though it is considered more of a male hormone. There is a bit of testosterone that we create and excrete in our bodies as well to create a healthy hormone balance. Many women who are diagnosed with PCOS have higher levels of testosterone in their system, and this can or cannot present physically. When you have higher levels of testosterone, then you might have an increase of hair growth, not on your head necessarily, but you'll see more hair growth like on the face, chest, back. Your arms might appear a little hairier in the lower arm. You might see more hair growth on your thighs, which traditionally you don't see much. The hair growth on your thigh tends to be less than that on your lower leg. But when you have higher levels of testosterone, you could see an increase of growth there. Also, growth of hair, increase of hair growth on your knuckles of your hands and also on your toes. Um, so that's something to look out for if you've noticed that. Also, increase in acne production, especially as an adult, where you didn't have acne issues before, or you've seen a dermatologist and it seems like nothing is really helping the acne production. It could be due to higher levels of testosterone in your system. So that is something, a hormonal test that your provider will most likely ask for. They will also perform pelvic exams or an ultrasound to see the health of the ovaries and if there are cysts that are present. So what happens? How do these cysts come about? Like we're talking about cysts on the ovaries. Where did they come from? Why are you producing it versus someone else who's not producing it? So what happens in the normal cycle of ovulation? You have, let's say, a small immature cluster of eggs that throughout the month while you're going through your cycle, those small clusters of eggs start the process of maturing. They're going to mature until it gets to the point where usually, typically, one of those eggs in that small cluster develops fully. It becomes a mature egg that's ready for release. When that egg releases, that's called ovulation. It's going to release from the ovary, travel down the fallopian tube, where if you are trying to conceive and it meets some sperm, it's going to fertilize, make its way to to the uterus to implant and develop into a fetus and grow into a baby for delivery. When that egg is released, the sac that the egg was in, it continues in the ovary and it basically shrivels up and gets reabsorbed by the body. Women who are suffering from PCOS, that immature sac of eggs that develops and begins to mature, that one egg never fully matures to the point of being able to be released in ovulation. So instead, that egg in its sac is traveling, basically traveling through the ovary, through the cycle, and at the point where normally the sac that the egg is now released from begins to shrivel up and die, because that egg was not released and it's still inside the sac, it can't shrivel up and be reabsorbed into the body. So it just basically shrinks, becomes a small fluid-filled sac that's inside the ovary now and just existing. This sac can cause pain. You can feel pain when you have these cysts in your ovaries, and the pain could either be, you know, just throughout the course of your menstrual cycle or what should be your menstrual cycle. You'll feel increased pain, pain during intercourse, things of that nature. Anytime you're seeing unregulated period and you're having pain, coupling that with potential hair growth that is different than what you're used to, or even the presence of acne, and also potentially any metabolic disorders like pre-diabetes or type 2 diabetes developing. These are the different diagnostic tools that providers will use to basically say, okay, with this whole picture, it looks like you most likely have PCOS. Excuse me. So now we've talked about kind of what PCOS is and how it is diagnosed. So I want to discuss now a little bit about how PCOS affects fertility. So there's several ways that PCOS affects fertility. One, obviously, if your hormone levels are fluctuating and you're not constantly ovulating every month, then your chances of being able to procreate are lessened because there's no egg present to fertilize. You haven't released an egg, so there's no egg to fertilize. And this can be troubling for many people because you're wanting to conceive. If you're wanting to conceive and you're not ovulating, then it's obviously going to create deep issues and a blockade with family growth and development. So there are many different ways that providers can use to try to treat PCOS for the ovulation purposes. So you typically know that you're having regular hormonal balance and you're ovulating appropriately when you do see yourself having a period regularly. So most providers, what they will use if you're not trying to conceive, they will suggest that you start on birth control pills. Mostly because birth control pills are hormonal. They do have a combination of hormones in them. It helps to regulate your system and then create the cycle so that you don't end up with what's called like oligomenorrhea or amenorrhea, where you're not bleeding or you're bleeding at random times, no rhyme or reason. You can't predict when your period's going to be. You want to have a period that's pretty regular, where about every roughly 28 days, you know that you're going to be starting that cycle over again. So being on the birth control pill where you're having the 28 days of hormones and then, you're having the few days of placebo so that you can then have the period. This is one way that providers can treat the issues of you not ovulating or having a regular menstrual cycle. Now, obviously, if you are trying to have a family, being on birth control is a little counterintuitive. So instead of that, then you might be prescribed something like Clomid or Letrozole, which are medications that help to jumpstart ovulation. These are really important and have been shown to have great effect in people with PCOS to help jumpstart that ovulation. And many women do find that once they start treatments like that, they do find that they can get pregnant right away because it was just that hormonal imbalance that they were experiencing that kept them from being able to conceive. But it's not necessarily 100% fixed. That's just one of the ways that providers are able to treat PCOS. Another treatment that you might see is metformin. Now, many of you who have who have heard of metformin or taken metformin know that it is primarily used to treat type 2 diabetes. And if you remember before when I was saying that insulin resistance or the prevalence of diabetes is a risk factor for developing PCOS. So, um, some of the off-label uses. So a lot of times someone may say, you know what, I have PCOS, but I don't have insulin resistance. I am not diabetic. So why would they put me on metformin? Well, metformin has its FDA approved uses, which is the common usage for the medication, which, as we said, is type 2 diabetes. But there also are what's called off label uses for the medication. A lot of times with some medications, what they will do is it'll be prescribed to treat one thing, and then you'll find that it actually helps something else as well that you weren't expecting. Research will be done to determine, was that a fluke or is that something that we can recreate and thus show a pattern or a trend. And once you see that with research that medication then can be used to help other disorders, then drugs will be approved to be used for off-label usage. So for PCOS, metformin is one of those medications that does have some off-label benefits, some of which include um, helping with PCOS related menstrual dysfunction. I wanted to look up so I could be clear because I don't want to give you any false information. So metformin, which is typically used for type 2 diabetes, it can be used to help regulate the menstrual dysfunction. And coupling that with medications like Clomid or Letrozole, then some women have been able to find that they're able to get pregnant naturally. But there are those who it doesn't, and then we turn to resources like IVF. Some other medications that are often used to also treat symptoms of PCOS can include statin drugs. So if you've ever heard of atorvastatin or rovastatin or pravastatin, so those are the generic names. So if you think of, let's see, atorvastatin, rovastatin, like Crestor, you know, that's a name brand that you might hear. These are medications that are typically used to treat what's called hyperlipidemia, or if you have increased cholesterol levels, which is something that is often seen in women who have PCOS. So you might be prescribed the statin not because you have high lipid levels, which it is possible that you can with PCOS, but also some of the off-label usage of the statins is that it helps to regulate testosterone levels, decreasing your testosterone levels slightly, which helps with symptoms like that increased hair growth, for example. So it could be any combination of medications, treatments. It's though PCOS is so widely diagnosed, it is very individual. It does not present the same in all people. You could have some of the signs and symptoms or some of the diagnostic criteria you could meet, and then others you may not. You might have increased testosterone levels, and you might have, let's say, um, you might have um, changes with ovulation in your period, but you may not have cysts present in the ovary at that time. Or you could have cysts present and increased testosterone, so you're seeing the acne and the hair growth, but you still get regular periods. Or you could have cysts present on the ovaries, you could have irregular periods and not have the increased testosterone levels. So you're not getting the increased hair growth or the acne being present. But even though each of those are slightly different, they all result in a diagnosis of PCOS. So it very much is going to be a trial and error process with you and your provider, trying to find all the different combinations of treatments that are going to help you. But there are some things outside of medication, which also can help, which are lifestyle changes, diet, and exercise. And I know we all hear this, we hear it so much from providers that diet and exercise changes, lifestyle changes should be your first course of action. Because when you have increased weight and more of a sedentary lifestyle, you increase your risk of developing type 2 diabetes, developing high cholesterol. That increased weight gain with fat being stored on your body can affect your hormone levels like testosterone, because testosterone is fat soluble. So it it can hoard itself because you have increased body fat. You see what I'm saying? So doing things like trying to stay eating a healthy and balanced diet and increasing your activity levels. So working out, amazing, walking regularly. If you're more of an activity person, you like to play sports, getting engaged in some type of sports, you want to try to create that active, healthy lifestyle. Because when you do that, if you're able to reduce your body weight, if you are overweight, if you can reduce it by even like 10%, you greatly increase your chances of regulating your hormones, hoping to regulate your menstrual cycle, and decrease your chances of developing more cysts and impacting your fertility. So, that's the first line of defense. And I know it is hard, especially with many of us who have very busy lifestyles. So many people, especially these days with the economy, you're working multiple jobs, you are, in and out of the house. You don't have time to cook, or it might be an expensive thing for you to go to the grocery store and try to get all of these healthy items. And so it might be more beneficial for you to be able to eat things that are quick and more affordable, which are not always the healthiest options for us. So I completely understand that saying, eat healthy, work out, it sounds good in theory, but it is not always easy for you to do. So that is that is why there are medications that are available to help treat the symptoms, which hopefully, once those symptoms are treated and your body is regulated, it will get you back on track. So, yes, hopefully, once you are able to get on a healthy medication regimen that treats those signs and symptoms, then you might be able to regulate your hormones and get you in a place where you're able to conceive without assisted technology. So that is a little bit about the treatment with PCOS. So now let's say that you have been treated, you are on the medications, your hormones are being regulated, you've decreased some of your body weight, you're seeing a regular period now, and you've gotten pregnant. You are definitely, definitely going to be at higher risk for some complications with pregnancy if you have a diagnosis of PCOS. And some of those complications can be developing gestational diabetes, or developing gestational hypertension or high blood pressure. And we really have to be careful when it comes to blood pressure, because you can develop what's called eclampsia, which is a very, very serious condition, and something that you would have to be admitted to the hospital to have your blood pressure put under control if you do develop eclampsia. So it is important, if you have a diagnosis of PCOS and you are able to become pregnant, your provider should probably connect you or recommend that you are connected to a high risk OB, a high risk obstetric doctor, to be able to monitor you, and just outside of the general monitoring in relation to pregnancy, having a high risk OB is going to be able to put you in that in that type of environment where they're going to be able to measure all of these factors. So when you are diagnosed with something like PCOS, you definitely should make sure that you are connected with a high risk OB, a high risk obstetric doctor, who's going to be able to monitor not just your pregnancy and development of your pregnancy over the course of 9 months, but they will also take into account everything that is related to the PCOS and how it can impact you. So, like I stated before, things like the gestational diabetes or gestational hypertension, these are some potential complications that you'll want to be monitored for. And having a high risk OB will help monitor and mitigate those risks. Also, you will most likely be connected with a maternal fetal medicine doctor who can help with the medical side or the medical aspect of your care, which a lot of times people are like, well, what's the difference? So when you're dealing with your obstetric care, your doctor is wanting to make sure not only that you're healthy, but mostly concerned with the health and development of your growing fetus during the pregnancy. Um, Having a maternal fetal medicine doctor on board with the high risk OB, they're going to take more into account your medical diagnoses, the treatments. They're going to look at everything with you as the woman, to make sure that you are healthy so that the pregnancy can develop and be maintained in a healthy manner. So having PCOS is definitely something that can cause for you to be more high risk. So you want to make sure that you are connected with those types of providers. Okay. Um, then outside of that, once you have delivered, you want to definitely get back in touch with your primary care provider or the provider who has been managing your PCOS, so possibly even the gynecologist, to start your treatments back in a healthy timeline, especially taking into consideration if you plan on breastfeeding, and making sure that none of those medications can impact the baby if they do come into breast milk. So it's definitely going to be something that you want to have all the proper providers following you to make sure that you are at your optimal health for your goals when it comes to growing your family. But something else, like I haven't already given you enough to think about, something else that you want to definitely take into account when we're talking about PCOS is that you have a higher risk of developing depression and anxiety. And when you are coupling that with pregnancy, then you also are at a higher risk for developing postpartum depression. So these are all reasons why we want to make sure you are connected with the appropriate providers. And if you have not found the treatment plan that has worked best for you to make sure that all of your symptoms are in check and that you're not, continuing to go further into ovulation issues to where you potentially stop ovulating or develop diabetes, type 2 diabetes, or high cholesterol levels, which can present cardiovascular issues down the line, heart problems down the line. Um, all of that is going to be dependent upon how quickly you get diagnosed and how much you work towards finding a treatment plan that is best for you. So, I know that was a lot. And hopefully I didn't talk too fast for you, but I definitely wanted to give some of that information because I do feel like though the diagnosis, as I stated earlier, is very prevalent and many women have it, there's not a lot of discussion explaining it, explaining why different treatment plans and options are chosen. And that can lead to confusion. It can make you feel like you're not really in control of your own journey with your body. And if you're trying to have kids with your fertility journey, um, and making sure your providers are on the same page with you. Because if you know that you're ready to have children, you want to start having children, then it would not make sense for you to be on birth control to regulate your hormones, right? And if you are not trying to have children and they start you on treatments like metformin or the statins or any of the medications that I discussed, those are by far not the totality of treatments, but just some of the examples that I wanted to give you. Um, if you're not trying to grow your family at this time, then having metformin, which could jumpstart your menstrual cycle and regulate it, and then thus making you susceptible to pregnancy, doesn't sound like the best option either. So you would want to make sure that you do have birth control on board, so that you do not become pregnant unwanted. And so that's just a lot to take into consideration. Again, understanding that each person is going to have a different clinical presentation and have many different aspects of signs and symptoms of it. So you want to know that it's not cookie cutter. Your presentation may be different than your sister, may be different from your aunt, may be different from your best friend, who you all could have a diagnosis of PCOS and it look completely different. Um, so I just wanted to give a little bit of um, background, some information. Hopefully, this is providing some clarity for any of you who are dealing with PCOS and didn't have as much information about it, understanding why you were prescribed different things. I hope that this has brought a little bit of clarity and insight for you. And again, if you notice that you're having any of these signs or symptoms, um, and you have not been tested for your hormone levels, you've not had an ultrasound and pelvic exam to see what your ovaries look like, then definitely, I hope you take this information and use it to ask questions to your provider, so that you can take a strong lead and advocate for yourself in your healthcare. And again, I look forward to any of the comments that you leave on YouTube. So this will be available. The video will be available on YouTube on at the Fallopian Files page. Also, if you're listening to us on any of the streaming platforms, then please leave a comment, like, subscribe on all platforms so that we can continue to grow our family. I look forward to hearing your feedback, to reading your comments. Please continue to grow our community. I've loved seeing all of the dialogue, and it's just continuing to show how we are not alone in this journey. So remember that you sharing your story might help somebody else feel less alone and feel like they have a little bit more strength in community. And that's what we want to grow with Fallopian Files. So I look forward to hearing from you. Thank you again for watching. Again, like, follow, subscribe. And until next time, this is Christian.